Recognize the Métis people who share a deep connection to this land. My name is Rob Miyashiro. I'm the Alberta NDP candidate for Lethbridge-East. And I'm joined here today by my fellow candidate and current MLA for Lethbridge-West, Shannon Phillips. I also want to thank Brandon Sand for joining us today. He's going to share his story on what he's gone through having an injury and having no access to a family doctor. 1 in 3 people in Lethbridge, like Brandon, do not have access to a family doctor. Seeing a family doctor for routine checkups or to ask questions about our health care is usually our first experience in health care. We take our children for their first checkups. We see them when we need we see the doctors when we need our own care, or we go with our own parents. We form bonds and relationships with our doctors and the staff at our clinics. But that isn't a reality for 1/3 of the people in Lethbridge. And lack of access to family medicine is becoming an increasing problem across the province. We haven't seen the UCP address this issue here. And now the issue is getting worse across Alberta. 3 years ago, the UCP launched their war on family doctors. They tore up the contract, cut their pay, bullied them online, and even in person, and forced doctors to learn a mountain of new paperwork just as the pandemic slammed into Alberta. As a result of the UCP's hostility and additional red tape, many have left the province, or retired early, or just left the profession altogether. We've seen the results of this right here in Lethbridge. Without access to a family doctor and with the closure of our walk-in clinics due to staffing shortages, families are forced to seek medical care at the emergency room, or even leave medical conditions untreated until they reach a crisis point. This can sometimes even result in patients feeling rushed out, untreated, or issues being overlooked as staff are overburdened and rushed. As we'll hear from Brandon in a moment, people are arriving at hospitals with longer wait times than ever before, sicker than before, and doctors and nurses working in these emergency rooms can trace the chaos they experience to the collapse of primary care in Alberta. The Alberta NDP are committed to ending the UCP chaos in healthcare, and we will do that by rebuilding the foundation of primary care. I'd like to now invite Brandon up here to share his story.
Thank you, Rob, and thank you, Shannon, for inviting me to share my story with you guys again. It was over a year ago that I stood with you and told my story about how in the summer of 2021 I fell and fractured a vertebrae in my spine. I went to the emergency room, which was overwhelmed with patients. Even with the fracture in my spine, I didn't receive any pain medication until I went to the drugstore myself with my prescription. It was obvious that the staff and doctors were overstretched and overburdened with the level of people in the room. And from what I understand, the situation in our emergency room has not changed more than 1 year later. After that visit to the emergency room, my pain persisted for months or over a year, even though I was told that with some rest and pain meds, I'd be able to slowly return to life and work. To make matters worse, I was one of the many people in Lethbridge who didn't have a family doctor, so I had no professionals to follow up with or call to ask questions. My pain wasn't getting better a few weeks later. The amount of pain I was in, and for the time it persisted, I had to reduce the amount I could work as a hairstylist at Catwalk Salon and Spa because it required me to be on my feet all day. I tried to make ends meet by taking on part-time work as the receptionist, but the financial issues I was facing, not being able to work full-time, really had an effect on my mental health and my livelihood in general. I've been able to get back to work finally in my trade since that terrible time, but for over 22 weeks, it felt like my life was stolen from me. If I had access to a family doctor or any health team, I can't help but wonder if I could have saved myself months of pain, grief, some financial stability, what my life could have been like if I had received some type of aftercare. I know I'm not the only person affected by this crisis in our healthcare system here in Lethbridge. We've been raising the alarms for years that we're struggling, and I haven't seen any improvements. Having options for doctors to take on more capacity with a team that Shannon and Rob are proposing here today would make such a difference in the lives of so many people in Lethbridge. I hope that it'll save many others from unnecessary pain. Thank you.
Well, thank you, Brandon, and thank you for joining us once again. Brandon was one of the people we've stood with many people over the years to discuss the family doctor shortage here in Lethbridge, and he was one of the people in late 2021 who shared his story with the community, really helping us raise the profile of this issue and make sure that at least we had some way to make the connection for a government that was not listening to either to this community, to healthcare workers, or to their patients. Now, primary care is meant to be just that. It's your first stop in healthcare. For 1/3 of people in Lethbridge, roughly, they do not have a doctor to take their children to their first well baby check-ins, or even a walk-in clinic for a toddler who needs an antibiotic for a painful strep throat. These are kinds of things that we can all remember for those of us who are have those baby years in the rearview mirror. Those are really, really important at times when you need care when you need it. Toddlers don't tend to like to wait. But routine problems or chronic conditions can be managed effectively through primary care before they become bigger problems. But without that option, with no doctors in Lethbridge accepting new patients, families here are left with no other option than the emergency room. This crisis has been ignored for over 2 years, and it is time for a change. It's time to take a new approach to primary care with a new government. Now, the Alberta NDP plan for primary care is called Family Health Teams. We believe that with the kinds of resources and the thoughtful planning approaches that we've put before Albertans here, this plan will allow 1 million more Albertans to be able to see a family doctor or another member of a family health team within a day or two and close to home. A family health team can include multiple family doctors, as well as nurse practitioners, registered and licensed practical nurses, mental health therapists, pharmacists, social workers, dietitians, community paramedics, community health navigators, physiotherapists, which would have been very helpful for Brandon, midwives, speech language therapists, and others. At a primary care practice, you will have immediate access to a range of primary care professionals who can and will help you with questions, managing chronic conditions, and supporting you in maintaining good health throughout your life, both physically and mentally. There will be less waiting, less bogging down emergency rooms for things like prescription refills, and less repetition of your story from doctor or health professional to doctor and health professional. You will receive your primary care in one primary location. There are similar working models across the province. There is one at the Tabor Clinic. There is one in Calgary. Now, the clinic in Tabor serves 16,000 Albertans, and each doctor is able to take on a higher volume of patients compared to traditional practice, as many of their patients' needs can be looked after by an allied health professional. This system saves money, too. The Tabor Clinic saved the healthcare system more than $62 million over 10 years, according to a recent study by the Health Quality Council of Alberta. These types of clinics, when government puts in place the supports and the leadership that we need to be able to deliver healthcare, and we know what the research and common sense tells us is the best way to meet people's health needs, these clinics help Albertans manage their health outside of waiting rooms and in ways that we can build on our successes. So with this plan, an Alberta NDP government will quickly establish 10 new family health clinics across the province, and you bet that Lethbridge will be on the top of that list to receive one. Rob Miyashiro and I are also committed to engaging with meaningful consultation with Indigenous communities and healthcare providers on how to best support Indigenous-led healthcare, and we will back that up with dedicated funding. Lethbridge-East candidate Rob Miyashiro and I believe foundationally, it's one of the reasons why we are in public life, that stability must be key in public health care. We know that families here are deeply concerned about the serious damage that Danielle Smith has done to public health care and the UCP have done over a period of years. But Rob and I also know that under an Alberta NDP government led by Rachel Notley, that we will bring stability, bring a caring and competent approach to strengthening our public health care like we are presenting here today. By adopting the family health team model, which is substantive, it is practical, it is cost-effective, and it will be the fastest way to solve the problems that we are seeing here in Lethbridge and in our region, we know that 1 million Albertans will be able to see a family doctor or a qualified health professional within a day or two. That is our pledge to this community. Thank you, and we'll now take your questions.
Great, thank you, Shannon. We'll first start with any questions in person.
Thank you. Shannon, do you have confidence that we can draw healthcare professionals to Lethbridge and that we can attract young people towards the healthcare profession and that we can actually fill those roles?
I have confidence that if we elect an Alberta NDP government led by Rachel Notley and a team that both respects public health care, its contribution to our province and our country, when we have a government in place that respects public health care workers, both from physicians all the way across the allied health professions, I have confidence that if we have that leadership in place and the structured, focused recruitment that this plan entails, that we will be able to reach that goal of 1 million Albertans being able to see a doctor or a qualified health professional within a day or two. Absolutely, I do.
That's all. Thank you.
All right, thank you. We'll now go to phones. Just a reminder for those joining us on the phone to use *9, and for those on Zoom to use the raise hand function. Our first question goes to Carly Robinson from City TV. Go ahead, Carly. Your line is open.
Is it coming through? Because I can't hear anything.
Carly, your line is unmuted. You can go ahead. All right, Carly, we are unable to hear you, so we will follow up with you after. We'll do one last pass for questions on the phones.
I'll just quickly add to my answer on that previous question because I think I missed a part there. Of course, you know, you always think of what you should have said when you're done with your answer. But I think it's really important to realize the strengths that we have here in Lethbridge, and it's not just the fact that we live in an affordable community with great amenities where we have everything we need within a short drive or walk. Even this is an incredible community and offers a lot to physicians and other allied health professionals. But what we have as well is a college and a university community that are willing to step up to be collaborative partners to solve these problems with government if they have a government that wants to engage in a good faith effort to recruit, attract, and retain people. And it's not just in training, at nurses. It's not just in graduating people with BScs that can go on to medical school. It's not just having the LPN program and the first 2 years of an RN program over at the college. It's not just that. It is also that physicians want to practice in a community where they have access to the kind of world-leading research that is going on at the University of Lethbridge. They want to have access to those kinds of workspaces as well. There are really good ways that we could cite new primary care access over at that university or concurrent with the college in 2 different anchor points of the city where we have very good partners who want to work with us. And there's no question that we can leverage those strengths to really build back after the hole that has been dug for us by now 3, almost 4 years of UCP war on healthcare.
All right, thank you, Shannon. With no further questions in the queue, we will wrap today. Thanks, folks.
Thank you.